Let me just tell you right from the outset, okay? I am not a pothead. And medical marijuana is what we're going to talk about, not the use of marijuana as some diversion, okay? It's not my interest. I don't support it. I'm worried about the long-term use or the popular use of marijuana as a diversion, okay? But what I am, by the way, I'm worried about alcohol, and I'm worried about the use of Percocet, and I'm worried about the use of drugs that are being given to kids, because the major source of addiction in the United States is really prescription drugs. So I'm going to focus here on one thing and one thing only. Marijuana. I live in Arizona. It passed here. There's a legalization of the medical use of marijuana. Regulations are still coming down. I'm going to talk to you about it in a minute because it's interesting what's going on. I'm going to try to get some guests on to talk about this in the future in more detail, because you need to learn about it for where you live in your state and what's going to happen to your life and what do you think about this. And I'm hoping that I can influence you. Okay? Now, first of all, here's the story. Is medical marijuana a gateway drug? No, but I will tell you what is. You take enough Percocet, Percodan, Dilaudid, methadone, which is, dope, right? You give it to heroin addicts, and they use it for pain management. There's your gateway drugs. It's nothing to do with marijuana, okay? Not when you're using it medically. And let me tell you what I want to use it for in my practice. I can't wait to get the regulations so that I will be able to either write a prescription or get permission for my patients to take it. Chronic pain, excruciating pain, dying of cancer, wasting away, lack of ability to eat anything, anorexia. Okay? Let's just talk about those. There are others. People with fibromyalgia, multiple sclerosis, people who have no resources. I have a patient in my office, 28 years old. She's dying of leukemia. She's dying. They've tried everything. It's not working. She's going to die probably in the next 3 to 6 months. She's in excruciating pain. And what do we give her? We give her prescription drugs that dope her up, have made her addicted. She slurs her talk when she's talking. This is not a life. And on top of that, it doesn't even work that well. And they have now proposed that I put her on methadone for the remainder of her life. That's insane. What we want to do is give people marijuana because that's what God made it for. And this is perfectly consistent with my philosophy about alternative medicine and natural medicine. This is a natural product. And guess what? You won't be able to make that much money in it. And I don't know for sure if the pharmaceutical business has been providing an enormous amount of disinformation to providers about marijuana and to politicians because they are very concerned about the loss of revenues associated with their pain medications. I don't know if that's true or not. That's what I've heard. Maybe it's true. Maybe it's not. Maybe it's sensationalism. But here's one thing that's for sure. Politicians, doctors, they're uptight about it. And I do believe that doctors who are in pain clinics are really uptight about the loss of income. They won't be able to dope up people anymore. Too bad, guys. Tough luck. And here's another thing. In the state of Arizona, the pharmacy, one of the pharmacy organizations that represents all the pharmacies, they believe that it shouldn't be allowed to what we're going to do here in Arizona, and as they have in California, Colorado, I don't know about New Jersey and some of the other states where it's been legalized, they have special stores that are dispensaries for marijuana. The pharmacies don't want that because they're going to lose business. They lose business in two ways. They lose the sale of the pain medications, which are absolute garbage, and they're going to lose sales because on your way to the pharmacy, that's always in the back of the store, you're not going to buy things like little hand massages made of gel foam, and they have 2 AA batteries, and after a while the whole thing kind of burns up and fizzles and wastes time, and you spend $5 on it. And then on the way out at the counter, when you're paying for everything, you buy bubble gum for $1.75. They're going to lose a lot of money. Too bad. The concern here is for patients. It is not, it's not a gateway drug. And if you're dying of cancer and you've got months to live and you have kids, which she has, this patient of mine has, who cares about it? You know what else somebody told me? Well, she might get high on it. She might get, an emotional high. I could care less. You don't think they're getting that from Percocet? What do you think kids are doing in the high school where my kid goes to school? You think it's not available in your high school? Oh, guess again. So, you know, I'm very frustrated. I'm frustrated because of the primitive nature of medicine. We're so arrogant. American medicine is so wonderful. That's why it's rated 15th to 25th in the world. There are countries that are emerging countries with much lesser economies, even in these very hard times, that have better health care than we do in the United States. And these arrogant doctors, there was a big campaign of pain management doctors in my community before the election. They are largely against marijuana. You know why? It takes it out of their control. It's not in their control. Primary care doctors could write for this stuff. Hey, don't be afraid of medical marijuana. Now, I think that the laws, and I think they're working on that in this state, need to be written in a way so that doctors who, you know, somebody walks in off the street and they get $200 or $250, they write them for permission to take marijuana when really they both know that patient is getting it to, you know, to have it for diversionary purposes. That should be not acceptable. And the law should be strict about the support of, well, the enforcement needs to support the law. I believe in that. And when people have said to me, it'll be very hard to enforce. Oh, and it's easy to enforce Percocet? Oh, it's easy to enforce Darvocet? And by the way, how many people drop dead from the overuse of acetaminophen, Tylenol? Okay? Let's get down to the real thing here. Are there side effects? I'm sure there are. Certainly smoking marijuana may be associated with certain kinds of cancer similar to smoking a cigarette, lung cancer, throat cancer. But of course you can take marijuana as a food. You can take it as a tincture. You can take it as a tea. There are going to be side effects, no question about it. But the side effect profile of clean marijuana, that means it's not tainted by any stuff that you buy in the street. It doesn't have something in it to hook kids on to methamphetamines or whatever. The fact is, it's pretty darn safe. It's pretty darn effective. And it's compassionate to use in many people so that they no longer have to suffer being addicted to prescription medications. And I do want to tell you, I have a patient in a children's hospital here in Arizona. And the doctor poo-pooed the concept of getting medical marijuana. Instead, the pain management doctor wants to put the kid on methadone. Let's addict the kid, 19 years old, for God's sake. And here's one other thing. I'm getting upset. I'm getting upset. So I'm going to calm down. I'm going to tell you what else is going on. You need to understand that the cost will be, the insurance companies won't pay for it. And doctors are trying to find ways, and hospital systems, because of their prejudice, not to allow people to use it. I have a patient, 30 years old, who had a liver transplant for no fault of his own, not a drug user or anything like that. And unfortunately, it's not working well, and he's going to need another one. He's on a list. He has terrible back pain. Back pain, we've tried injections, acupuncture, meditation, pain medications. He's had 2 surgeries. None of it works. Here's a guy whose life has been very tough. God has decided, for whatever reason, that he's going to have a very tough road to hoe. And so he has excruciating pain. It's impossible to deal with. And most of the medications that I would use not only are bad for the reasons I've already mentioned, addiction and so on, but they're liver toxic to a liver he has that's already failing. But I can't give him marijuana. You know why? Now, I can't give it to him now anyway, but I suggest that he go to California where it's legal and get it. You know why? Here's why. Because if they test him for marijuana, and if he's positive, they're going to take him off the waiting list. He's been waiting for years. There's a kid who died in another state. I think it was the state of Washington. Was it a kid or an adult who died because that person used marijuana? In my state, the law that was passed says that you cannot be prejudiced against because you take medical marijuana. In other words, approved by a physician. Yet, when I called the transplant team about my patient who has liver disease, and I asked them what they're going to do, they've been taking their sweet time in responding. Okay? They are taking their sweet time because they're going to try to delay this. They said they're going to study it. They're going to explore it. They're going to perhaps set up guidelines. What they're going to try to do, basically, is find an angle that they can get around the law that was passed by the will of the people in the state of Arizona. Don't let that happen to you. And I will have on in the future guests of some of the people who have helped spearhead marijuana in this state. I'm totally in favor of medical marijuana. God made it for a reason.